In this video, I will be talking about X-ray of foreign body in the esophagus versus trachea. How to differentiate them. It is a very important topic in case of ENT as well as medicine OSCE examination. So first of all, we have to know the position of the trachea and the esophagus. Anterior to posterior. This is the trachea. This is the esophagus. This is the prevertebral fascia. Prevertebral fascia. This is the vertebral body. Vertebral body. Okay, this is the esophagus. The trachea. See, the esophagus in this case, clearly you can see that it is a collapsed muscular tube where the transverse diameter is more than the AP diameter. See, this is the transverse diameter. This is the AP diameter. Clearly transverse diameter is more than the AP diameter. In case of trachea, due to the presence of C-shaped cartilage rings, right? C-shaped cartilage rings, the AP diameter is more than the transverse diameter. So in case of flat foreign bodies, like a coin, right? So the coin will, in case of esophagus, if the coin gets lodged in the esophagus, it will attain the wider dimension. It will align with the wider dimension. So in case of foreign body, or suppose a coin in the esophagus, suppose in this X-ray, there is a coin in the esophagus. So since the transverse diameter is more than the anterior posterior diameter, the coin will align in the transverse diameter. So we can clearly see that this is a chest X-ray AP view. Why AP view? Because the clavicle is above the lung field. This is chest X-ray AP view. This is X-ray of neck, lateral view, right? So we can clearly see that in this case we can see the face of the coin, right, in the AP view. Face of coin in AP view, and the lateral view shows that the edge of the coin. This is the edge of the coin, right? So in lateral view we can see that the edge of the coin. See, the coin has aligned itself along the transverse diameter, so it is in the esophagus, okay, because the orientation is coronal plane. Whereas in case of coin in trachea, this is the lateral view chest X-ray. The clavicle is over the lung field, so it is a chest X-ray PA view. See, in the lateral view we can see that the coin is, see, in case of trachea the coin will fit like this, okay? The coin will align itself like this. In case of esophagus, the coin will align itself like this, right? So since it will align itself like this, so if we do a chest x-ray PA view or the AP view, we will see the edge. Whereas if we do a chest x-ray AP view, we will see the face of the coin, right? In case of esophagus. In case of trachea, what we will see, if we do a x-ray AP view or PA view, we will see that the edge of the coin. And if we do a lateral view, we will see that the face of the coin, right? So here clearly the PA view, we are seeing that the edge of the coin, right? We are seeing the edge. See, this is the edge. It's the edge of the coin. And in case of lateral view, we are seeing that the face of the coin. This is the face of the coin. This is another X-ray. See, this X-ray AP view. Y AP view, the clavicle is above the lung field. Okay. In case of AP view, we are seeing that the face of the coin. So it is clearly foreign body in esophagus, right? Why? Because the coin aligned itself along the greater dimension. Okay, so let's sum up this thing. Feature first is orientation. In case of coin in the esophagus or flat body or flat foreign object, we will see that it lies in the coronal plane. Whereas in trachea, this plane is sagittal plane, right? This sagittal plane. In case of anterior posterior X-ray, in case of coin in the esophagus, we will see that the face of the coin. Whereas in case of lateral X-ray, we will see that the edge of coin. And the reverse thing will be there in trachea. In AP view, we will see that the edge of coin. In case of lateral X-ray, we will see that the face of coin. That's it. Thank you.